In the last two episodes, we discussed the importance of assessing the ocular surface and preparing it for lens wear, along with introducing some new multifocal lens options. In this episode, we'll discuss preparing the patient for success with multifocal lenses. There are really three things that go into preparing the patient for multifocal lenses. The first is making sure that we utilize the fitting guides when working with the various multifocals. All of the companies have developed fitting guides for their lenses, which usually come from experience with a large number of patients. As such, they guide us to successfully utilize the respective lens designs. At times, there may even be counterintuitive steps that need to be taken when problems arise with the fitting process. By following the fitting guide, you'll optimize your chances of successfully fitting your presbyopes in multifocal lenses. The second factor to keep in mind is to demonstrate success with the lenses. The way that we typically proceed through our contact lens fits is, after lenses are placed on a patient's eyes, we test their distance vision. When we fit multifocal contact lenses, this may actually seem a little bit worse to the patient who is used to wearing single vision lenses. The reason why is just as its name implies, with a simultaneous design multifocal contact lens, both the distance and near optics are simultaneously focusing light on the retina. That means that the distance vision may be slightly worse with the multifocal lenses than with the single vision lenses. But because of the near optics incorporated into the lens design, that also means that the near vision will likely be better. So instead of presenting the patient with what may be worse vision than their current lenses in the distance, it may behoove us to demonstrate their near vision initially before their distance vision is tested. We find it effective to utilize things that a patient uses on a daily basis. One thing that almost all patients have in the exam room is their cell phones. By having patients use their cell phones before checking their distance vision, you're demonstrating success initially and the advantage they offer over their single vision lenses. We have found this a remarkably successful strategy for first-time multifocal lens wearers. The third factor to keep in mind is to make sure you give the lenses time to settle on the eyes before you assess the fit and vision. This is important to do because as lenses are settling on the eyes, they move less and provide more stable optics for the patient to look through, optimizing their visual outcome. By following these three steps and these three tips, we are sure you will prepare your presbyopic patients for multifocal lens success. First and foremost, make sure that you utilize the fitting guidelines for the multifocals that you are in fact fitting. Second, make sure to demonstrate success with the lenses such as improved near vision before demonstrating distance vision with a traditional Snellen chart. And third, make sure to allow adequate time for the lenses to settle on the eyes in order to allow the lens optics to stabilize. Ultimately, this will help more of our presbyopic patients become more functional and improve their quality of life through successful contact lens wear, which is ultimately why we do what we do.